Emerging consensus. The UK government's global consensus on MNHCH, the World Bank, WHO, and DFID have given support, have pledged their support to technically and financially support those countries who wish to remove free healthcare. Since 2000, many African countries in the sub-Saharan district have been removing user fees from their facilities because they see that this is the only way they can attain Millennium Development Goals and improve sudden outpatient utilization rate. Niger, Senegal, Liberia, Ghana, Burundi, Zambia, Kenya, Uganda, and Sudan all removed user fees. And recently, Sierra Leone has also removed user fees in April 27, a few months ago. The arguments made in Sierra Leone focus on Millennium Development Goals 4 and 5. It was found out that Sierra Leone is far from reaching Millennium Development Goals 4 and 5. And the only way to achieve this within 2015 is to remove user fees so that poor people and everyone will have access to free services. It's a proven quick win in terms of improving access. Strong efficiency and equity arguments. Allow space for other public and private mechanisms. It can be achieved for under 5s and pregnant and lactating women. Countries can define their own package of services. For instance, in Sierra Leone, package of services include pregnant women, lactating mothers, and children under 5. Consistent with universal coverage and rights, many low-income countries are doing this anyway, not to knowledge. Preparation for 27 April 2010. In Sierra Leone, what happened is that before the president announced in a donor conference in the UN Assembly that the country wants to remove free user fees, the country's situation was analyzed. A survey conducted by the Ministry of Health in 2008 shows that there are many barriers for people not accessing health, including traditional beliefs, including the referral pathway. But one thing was found is that about 80% of people complain that the cost attached to services prevents them from utilizing health services. And after that, after this was found out, the president himself and the government declared that they want to have a free health service in the country. And immediately after that, a steering group was formed with 6 subcommittees, which will report on a weekly basis to the steering group. And these 6 subcommittees include in areas of human resource, logistics and drugs, communications, M&E, financial governance, and infrastructure. The communications subcommittee was co-chaired by Save the Children. And after all the systems was put in place, the president himself launched the removal of free health care, the removal of user fees, that is the Free Healthcare Initiative on April 27, which was also the Independence Day of the country. The success, immediately after the president launched the Free Healthcare Initiative, we see lots of people waiting for services. This is at the main maternity hospital in Freetown, Sierra Leone. Another success, we see people waiting for services at a peripheral health unit in a small community. Thank you for listening.